Hello, my name is Krysteena Anderson, and I am going to talk about healthcare-associated infections. I'm a nursing student in Indiana State University's LPN to BSN degree program, and this is the NURC 444 Community Health Nursing class. Learning objectives: to identify what the common healthcare-associated infections, HAIs, are, to review the number of cases per year, to review the cost per infection per year, to learn how to prevent the spread of HAIs. Most common healthcare-associated infections, HAIs, are Clostridioides, I know it as Clostridium difficile infection, C. diff, CDI, central line associated bloodstream infection, CLABSI, catheter acquired urinary tract infection, CAUTI. Clostridioides difficile infection, C. diff, C. diff, also known as that long name, is a germ bacterium that causes severe diarrhea and cholecystitis, which is an inflammation of the colon. Most common cause of C. diff is the most common cause of healthcare-associated infections in the United States. It was also classified as an urgent threat by the CDC, which is the Centers for Disease Control. In 2011, there were an estimated 450,000 incidences of C. diff in the United States that led to an estimated 29,000 deaths. And there's approximately a $5.9 billion cost for treatments that is spent per year. To prevent C. diff, healthcare providers simply have to wash their hands with soap and water in between each patient, regardless if they have C. diff or not, but especially if there is a known exposure to C. diff. Soap and water is the only way to prevent the spread. And also wearing PPE such as a gown and gloves, and washing your hands before and after putting on gloves. Central line associated bloodstream infection, CLABSI. A central line associated bloodstream infection is a serious infection that occurs when bacteria, i.e. MRSA, enters the bloodstream through the central line. Healthcare providers must use the sterile technique when inserting the line and aseptic technique with dressing changes. Patients who get a CLABSI present with fever, redness, and tenderness around the central line. There is an estimated 80,400 cases per year for CLABSI and an estimated $6,000 to $9,000 cost per year. CLABSI prevention. Again, the provider, the physician, inserts the central line using the sterile technique, and the nurses maintain the central line using the aseptic technique. Catheter acquired urinary tract infection, CAUTI. A urinary tract infection, which is a UTI, is an infection involving the urethra, bladder, ureters, and/or kidneys. Catheter-associated UTI, a CAUTI, develops from prolonged use of the urinary catheter. As a preventative measure, catheters should only be used when indicated and removed when no longer indicated. CAUTI prevention. Again, to only be used when necessary and while in use, maintain a closed, unobstructed drainage system below the level of the bladder at all times, and to change the catheter if obstruction occurs. And that's when an obstruction that cannot be fixed occurs, and the line is potentially just damaged and no longer of any use. There are an estimated 93,300 cases per year from CAUTI, or catheter-acquired urinary tract infections, from CAUTIs, and an estimated $1,000 spent per infection just to treat. Pre-test, post-test. 1. What are the common healthcare-associated infections? C. diff, CAUTI, CLABSI, all of the above. All of the above. What is the most common HAI? CLABSI, C. diff, CAUTI, or MRSA? That would be C. diff. How is an HAI spread? Poor hand hygiene, not wearing proper PPE, deficient knowledge. D. All of the above. Yes, D. All of the above. Who do hospitals report cases of infection to for tracking? Charge nurses, primary care managers, PCMs, Board of Medicine, or the Centers for Disease Control, CDC? D. CDC. How must a nurse clean their hands after working with the patient with C. diff? A. Don't worry about it if your hands aren't soiled. B. Wash your hands with soap and water for at least 20 seconds. C. If soap isn't available, then vigorously rub hands with hand sanitizer for 20 seconds. D. Wash hands with scalding hot water. B. Soap and water. Whose responsibility is it to prevent the spread of HAIs? A. The nurses. B. The physicians. C. The patient family. D. All of the above. D. All of the above. When should a Foley catheter be placed? When it's more convenient for the nursing staff. B. If a patient requests it. C. Only when necessary. Or D. If the patient's family requests. C. Only when necessary. What type of technique should be used for a central line placement? A. Clean technique. B. Sterile technique. C. Aseptic technique. Or D. Either of the above techniques. B. Sterile technique. Which technique is used for central line maintenance? A. Aseptic technique. B. Clean technique. C. Sterile technique. Or D. Either of the above techniques. A. Aseptic technique. And lastly, how to prevent a catheter-acquired urinary tract infection. A. Maintain a closed, unobstructed drainage system. B. Keep the drainage system below the level of the bladder at all times. C. Change the catheter if obstruction occurs. D. All of the above. D. All of the above. Here are my references. Thank you.